So, like I said before, my project is basically um a clinical it's like a diagnostic tool to predict sepsis 6 to 12 hours before clinical diagnosis. It it has machine learning techniques to integrate regression-based methods, and it predicts like it has like a early detect it's like a early detector for sepsis, which shows um possible ways for it to like for intervention basically. So sepsis presents a significant diagnostic challenge due to subtle onset and varied symptomatic presentation across patients. So it makes early detection difficult for clinicians, where this comes into play, where I can process vast quantities of medical data or like data sets from other places, and I can use I used patterns and temporal trends to like observe and then provide like a result to the user. So sepsis is usually diagnosed too late after the patient has already started to see like symptoms of it, I guess you could say. So doctors use um they usually diagnose sepsis after a after like actual signs appear. But with this, you can use it to detect it way faster, so you can like reduce patient costs, and then you can just help from getting worse. Like it helps you like, prepare ahead of time. So that's basically a picture of the interface, and it tracks patient data such as heart rate, respiratory rate, body temperature, oxygen saturation levels, and these features are crucial inputs. So it makes sure that the machine learning model can detect differences like physiological shifts and deviations that could signify the early stages of sepsis onset. So this project uses a supervised learning paradigm where the model is trained on a data set explicitly tagged with known outcomes. This means that the patient's measurements are paired with definitive results. So basically I gathered a data set where it has like similar patterns. So yeah. So I used logistic regression, which I learned in this course. So it's basically um it it, it employ it frequently employed for binary classification tests despite its regression nomenclature. It predicts the outcome. This application uses that to generate a probability score, indicating the likelihood of a patient developing sepsis as soon as possible. And so we split the data into training and testing set, as you usually do for any predicting model, and to ensure robust performance and prevent overfitting. The data was divided into those two different sets, and we trained the data set, and then we use a testing set to check if it actually like makes sense or not. So our model evaluation metrics was accuracy to perform correct predictions, and then to recall to capture true positive. So it's like um, so it can like actually help real hospitals instead of just like a normal tool which is not useful. And we use precision, which minimizes false positives, so you can actually provide correct results, like more accurate results to the user. So recall was, like I said, it prioritized due to the life-threatening nature of most sepsis cases, optimizing the model to identify as many true positive instances as possible. And this is a user-friendly application that uses previous patient data and use trained regression model and generates a clear sepsis risk score. Um, this system is designed to function as an early warning tool, empowering clinicians with information to guide the decision rather than replacing actual doctors, as this is not a fully tested medical practice. It's used as a tool to like just let them know like what's going on. And yeah, that's my presentation. Okay, so this is basically the front hand side of my application. It
Okay.
shows it has these different features to it. I think I have to wait. Can I unshare real quick? I forgot to like deploy it.
Okay. Okay. Take your time.
Yeah, just 1 second.
Sure.
Okay, I had to go to terminal and like re run it. I guess. Yeah.
Never mind.
Okay. So this is my front hand side of my project. It takes inputs like heart rate, respiratory rate, systolic BP, and then mental status, and then all of these features. And then when you give it a random value, I guess. I mean, when you give it real value, I'm just showing it as an example. And when I click evaluate risk, it shows these signs, and then it also gives the probability of showing if it has high sepsis risk or not. And then um this is what I was saying about the additional thing I added. So it saves the context, and then you can ask the AI chat directly from the knowledge you gain about the high risk. So now you can ask it anything how like ways to mitigate this risk. And then oh, I forgot to set the API key. I don't know why,
Okay.
but it usually works. Yes, I don't know what it's doing, but
Okay. Okay. Great.
so yeah,
Okay. So your
it,
project looks good.
yeah, it provides a detailed feedback on like ways to mitigate it, basically using the API key.